Welcome back to another numbers game. Listen here, folks. I'm excited. I have a doctor with me, the first doctor on my show of many to come. I'm putting it out there. I believe in law of attraction, and I know God hears me saying this and claiming it. So, but at any rate, I do want to remind everyone that my purpose in life is to help others, and I have a passion to help others to succeed. I believe that it does not make sense, CENTS, to be healthy and not gain wealth, just like it does not make sense, SENSE, can't spell all of a sudden, to be wealthy and not have better health. So without further delay, everyone, I want to introduce to you, to some, and some may already know, Dr. Uma Reddy, and she is here to talk to us about fibroids. Thank you, Dr. Reddy, for joining us today.
Thank you, Kim. Thanks for having me on your show.
And I am, when I met Stacy at an event, and I had to do like a little promo, and she gave me this write-up. And as I was reading about it, and we'll get into why I was so excited about it, I was like, I'm telling myself in my brain, this can't be real. Are you serious? A woman with fibroid and not having surgery? Oh my God, I have got to get these people on my show. So before we get to that point, tell me a little bit about you professionally.
Sure. So I am an interventional radiologist, which means I'm a radiologist first, and then I did additional training in interventional radiology, which is a specialty that involves doing image-guided procedures. And there's 100 different type of procedures that we could do in this specialty. So that's pretty much it. So you got to go to med school, do residency in radiology, and then do fellowship in interventional radiology. And typically our specialty works in bigger hospitals and university hospitals and all those county hospitals. But yes.
Okay. How long have you been in your profession?
So I've been practicing. I finished all my training about 9.5 years ago. So I've been practicing this for 9.5 years now. Yeah.
Wow. That's amazing. That's amazing. And thank you for your service, because COVID, just like others, I don't think I stand alone in this, heightened the fact that people such as you and in the first responding profession, how detrimentally important you are to our society. I think I can speak for a few. We take our doctors for granted. We just do. We expect you to have all the answers and do all these wonderful magical things to fix us. But I think we don't give credit to where credit due at times. So I do want to say, on behalf of anybody who thinks like me, thank you for your service and the contributions you provide to the medical field. So
thank you.
Awesome. So now let me ask the $1 million question, because there's some out there that may not know. What are fibroids?
Sure. So fibroids, they are benign, that means non-cancerous tumors of the uterus. Okay, they're very common. They grow in the wall of the uterus. So one of the muscle cells within the wall of the uterus, it reacts abnormally to normal stimulants, and it just keeps dividing, multiplying, and it turns into a big ball of tissue, and that's called fibroids.
That sounds painful.
Yes, fibroids can cause lots of symptoms. They can cause a lot of problems.
Wow. Are fibroids common?
They're very common. Up to 70 to 80% of women have fibroids by the time they reach age 50. It's very common in African American women. Yes, they are disproportionately affected, and a lot of women have this. It's a very common problem.
Is it? What are some symptoms?
Right. So fibroids most commonly cause problems with bleeding. You could have heavy cycles, heavy bleeding, passing clots, changing pads or tampons every hour. They could. You can also have prolonged cycles, bleeding between the cycles. And they can also cause pain, abdominal pain, pelvic pain, back pain, pain going down the legs, pain during sex, Yes, and they could also put pressure on your bladder, rectum, and can cause bladder problems or
Mhm,
constipation, bloating, and they could also make your belly bulge, like you may look like you're pregnant,
mhm.
and they could also cause infertility in some cases.
Wow.
They can cause complications during delivery. They can increase your risk of having C-section and placental problems, and they can also cause more life-threatening problems like
Mhm.
blood clots in your legs that can go to your lungs. They can cause kidney failure. They can cause very bad anemia that can cause heart
Wow.
failure and some life-threatening problems also.
This non-cancerous tumor is is huge. I mean,
It
just with
is.
everything you just mentioned, you said women up to the age of 50, and I'm assuming because at some point in time menopause kicks in and that this may or may not be an issue, but just the women that go just through life, everything you've mentioned can be a symptom of something else, and we don't think it's fibroids.
Exactly. Yep. Yep.
Wow. Wow. I'm now I'm going back in my mind. Do I have any of this?
Exactly. A lot of times, especially with the heavy bleeding problems and the pain, women are told that's normal. Just suck it up and just live with it and not complain. So a lot of things women think that's just normal cycles and they don't seek help. They just keep
Wow.
suffering until it's too late. Yeah,
Suffering in silence.
that's true.
Wow. Wow.
Yeah.
So with having these symptoms and you actually get to somewhere when someone is saying, well, it looks like this actually could be fibroids. What
Mhm.
are various traditional medical treatments for fibroids?
Yes. So before I get to treatments, so let me talk a little bit about how it's diagnosed. So you'll
Okay.
have these symptoms, and at some point, typically women suffer for years before they seek any help. So
Mm,
eventually, when you bring these issues with your gynecologist or with the primary care, they'll do some abdominal exam. They feel the mass, and then they may do an ultrasound. That's when they know you have fibroids.
mhm,
And then they'll typically, for treatment purposes, they'll give you birth control pills, and they can give you combination of estrogen, progesterone, or just progesterone, or they can suggest some dietary modifications, losing weight, all these other non-medical things that could help you with the fibroid symptoms. And if your bleeding is very heavy, they can give you other medication called tranexamic acid to help with the heavy bleeding. And if none of these medical treatments work, then they will end up suggesting either hysterectomy, most commonly, and sometimes uterine fibroid embolization is what patients will hear about.
wow. So now I have two daughters. They're 24 and one is about to be 23.
Mhm.
And just generationally, I talk to my daughters and my mom and I, we have conversations, and we've been heavy bleeders from one generation to the next.
Mhm.
And I don't have that problem anymore. I had a procedure done many moons ago after I decided I didn't want to have any kids. It's not a hysterectomy. I had Novasure, an
Mhm.
ablation done. So I don't have those. I can't connect with my daughters anymore because of that procedure. But just thinking about what you're saying and some of the conversations that I've had with my daughters, or just with them, mom, this cycle thing just feels a little weird this time, or it's making me wonder, should I
Mhm.
advise them to go to a professional, say, hey, can you check me for fibroids instead of giving me the band-aid in a sense?
Sure, yes. So, family history is one of the common risk factors of fibroids. It
Okay.
runs in family. So, if somebody in your family has fibroids, you're at higher risk of having fibroids. Okay, there's other risk factors too, like age, obesity. African American race is also a common risk factor.
Hmm.
Other things like diabetes or high blood pressure, vitamin D deficiency. And in African American women, hair relaxers are also linked with a higher incidence of fibroids.
Hmm.
So yes, it does run in families.
I'm
You
so
should you
glad
should
you said that. about the hair relaxers. I didn't mean to cut you off because I am a stylist, and so is my
Oh,
24-year-old. We're both licensed cosmetologists and barbers. We do it all basically. And I wore a relaxer from high school up until about, let's see, I deployed to Kuwait in 2015. And one of my soldiers dared me. She's actually a friend of mine. She said, I dare you to cut your relaxer off and go natural. And I'm like, I don't know what this natural thing is about. I love my creamy cracks. In my community, that's what we call it, creamy crack, because we like that silky smoothness and how that makes
gotcha.
the hair look. So
Sure.
um, now talking to you, I don't suffer from fibroids. I have not ever suffered from fibroids, but
Mhm.
not, I need to go back and thank that friend of mine, because I was that person with the heavy bleeding and a lot of other those symptoms that you mentioned.
Mhm.
In my whole military career, never even thought to say, hey, check me for fibroids. Maybe that's what this thing is, and how it could be linked to me wearing relaxers. Now, my daughter, and she'll
Mhm.
eventually hear this conversation, the stylist wears a relaxer. Now, I don't know what type of relaxer she uses. And folks, I'm not saying don't wear relaxers. I'm not saying to quit it. I'm just saying you need to talk with professionals such as your stylist and your wellness professional and get checked up on a regular basis to make sure what we're putting into our bodies, these chemicals with the hair, even the food, just anything that you're externally putting into your body, to make sure these toxins are not leading to what could cause something like a fibroid tumor, and cause some of these other things, that these symptoms that Dr. Umaredi talked about. So I'm gonna, when she hears this conversation, I know she's gonna go, "Oh my God, Mom, I don't know what I'm gonna do with my hair now." But I'm gonna just tell her to get checked
Yes.
first before you make
Sure.
that type of decision and get scared about your hairstyle. How
Mhm.
how you're choosing to wear your hair versus how it's reacting with your body. It's better to be safe and get answers from a medical professional versus just doing something drastic. Now, I did the drastic change and did the big chop in Kuwait. Well, actually, right before I
Mhm.
left Kuwait, I was at Fort Hood, and I did the big chop. I didn't know I had curly hair. Now, today it's pink. Last week it was blue. It may be white 2 weeks from now. I don't know. I'm actually thinking about going yellow, but these are what I have in my hair is a non-chemical based color that I just kind of spread it on, and I can wash it out, and it's a semi-permanent basically, and keep it
Yeah.
going if I wanted to. But all of that to bring it back to the conversation, um, in time, because I'm only probably 3 or 4 questions in, and you have repeatedly said this is something that affects African American women.
Mhm.
Repeatedly have said this, and I'm not asking you to be that environmentalist, but I would tend to say, I would lean to say that it's our behavioral pattern in terms of what our ancestral path has taught us about managing our lives, in terms of it being a genetic generational disease. It sounds like it's hereditary, because we keep passing on these same behaviors and patterns from one generation to the next with our women, and it's almost killing us.
Yes. So the research hasn't shown any particular gene that's responsible for fibroids. So
Mhm.
African American race and running a family history, those are some of the risk factors. Yes, if you're African American, if you have a family member, yes, your chances of having fibroids are very high.
Yes, yes, and my to my knowledge and my lineage, we don't
Mhm.
have that fibroid transference from one generation to the next, but
Gotcha.
it does not mean that it can't start at some
So
point in time.
right, so fibroids, they do not always cause symptoms. So I may have fibroids, I just don't know. I was never diagnosed because they're not bothering me. So you may have fibroids, but you're not suffering, so you didn't have to have the investigations and the ultrasound or any testing to see whether you have it or not.
Gotcha. And that's good if it's not causing the symptoms, but
Right.
but if it's causing the symptoms, then yes, we definitely need to get to a professional to be reassessed, so we can make
Correct.
an educated decision about that wisdom piece about our bodies. Now, Doc, how do you treat fibroids?
Right. So we treat with a minimally invasive procedure or non-surgical treatment option for fibroids. It's called uterine fibroid embolization,
Hmm.
or UFE, or sometimes it's called uterine artery embolization, or UAE. They're both the same.
Okay.
Embolization means blocking the blood flow
Hmm.
and killing a tumor as a result of that. So we use this technique for different tumors in the body, for liver tumors, for kidneys, for prostate in men. Anywhere we need to kill a tumor by blocking the blood flow, it's called embolization. And we do it
Okay.
for both cancer and non-cancer treatments. So in this case, fibroids are non-cancer tumors, and we're killing it by blocking the blood flow. So it's a uterine fibroid embolization.
Gotcha. So now, folks, I want you to hear what she said. She brushed by because you deal with this on a regular basis because it's your profession. She said non-surgical. I want to highlight that because that's huge. When we first started talking about how you traditionally treat fibroids, removing that portion of a woman's body kills her ability, depending upon where she is in her age range, having been able to reproduce and having children. You know, hysterectomy is not the result of it is you no longer have cycles. Okay, whoop-de-doo. But then before we get there, is there something else we can do that doesn't cause us to have surgery? And having this uterine fibroid embolization, it seems like that could be a great answer if you are a good fit. So why would a woman choose the uterine fibroid embolization?
Like I said, it's a minimally invasive non-surgical treatment option.
Mhm.
Not only that, it's the risks associated with the procedure are much less compared to surgery. You're
Uh-huh.
keeping your uterus, and the recovery time is much shorter compared to surgery. So recovery time typically is 1 week. You just take a week off from work, and then you're ready to go back after 7 to 10 days.
Really?
Yes, and you won't have any scars on your belly. There's no sutures, bleeding, nothing like that. And we do the procedure through the wrist, so you'll have a small dot on your left wrist and a band-aid on it. So no cuts even on the hands. Yes.
Wow.
It's a very simple, very safe procedure. So once a woman knows that this option exists, it's almost like a no-brainer. Why would you choose a surgery?
Why
when
would you
have
not
this
do it?
simple- Right,
Exactly.
right.
Is there a reason in terms of, I guess, from your experience, why a person would not be a good fit? Like maybe the tumor has gotten too big, or I don't understand about all of that.
Right. So, majority of the women with fibroids are eligible, or suffering from fibroids, are eligible for this procedure. The
Wow.
only time when we say don't do it is when a woman is actively seeking pregnancy or actively trying to get pregnant.
Mhm.
Those patients, we say to go do a myomectomy, which is a surgery just to taking the fibroids off and keeping the uterus in place. We don't have enough data showing the effect of UFE on future pregnancy, but we tend to be on the safe side. We say just let's not do it, let's do myomectomy if pregnancy is a top priority.
Okay.
But other than that, or if on the MRI, if something looks suspicious for cancer, then we say, okay, let's not do it, go take it out surgically. Other than that, majority of the women are eligible for the UFE, and the size of the fibroids, and the number of fibroids, and location of fibroids is not a problem. All the fibroids, any number, any location, they all die and they cannot grow back.
Wow. I got chills. I got chills when you just said that it doesn't matter the size, the location, or the number. Most women, or majority of the women is what you said, are eligible for this procedure. That's amazing. That's That's amazing. I mean, that's life changing.
It is. It is. And sometimes, if a woman has a very, very large fibroid, like a 9-month pregnant size fibroid, even though it dies and shrinks and scars down, there may still be a decent amount of fibroid left over. So in those
Okay.
patients, sometimes we do this procedure along with the surgery. So a surgeon wants to take out the big fibroid, but they want to kill it, shrink it, make it small, so they're able to take it out easily with a smaller cut on the belly. So you can have a UFE before the scheduled hysterectomy.
Okay.
So that way your surgery will be much easier. It's less complicated. You don't bleed as much blood during surgery, and your scar will be much smaller.
Okay.
This is in a small number of selected patients, but majority of the patients, once they have this UFE done, they don't need any other treatment. They don't need to have surgery.
Wow. This is this. I'm like you. This is a no-brainer. I mean, my next question was the hysterectomy versus UFE, but this is like, sign me up today. I need what's going through my wrist versus moving a whole body part out of me. You know, this is huge, Doc. This is huge.
Yes. So this procedure is about 30 years old, and we first started doing through the blood vessel in the groin, femoral artery, and about 10 years ago we switched to the wrist because it's very convenient. The recovery is much faster, easier, and less risky also. So majority of the women, about 98%, we do it through the wrist. And if somebody has a very small blood vessel in the wrist, or if there is any problem, anatomical problem, then we can always go through the groin.
Okay. I think I failed to ask this one question earlier, is how are fibroids diagnosed? And you touched on it, but I kind of want to dial in on it a little bit.
Sure. So typically when a woman has symptoms, they'll go to their gynecologist or primary care, and they'll do the physical exam. If the fibroids are big, they can feel it when they push on your belly. They can see the big mass. But most commonly it's diagnosed by ultrasound. Ultrasound is what they do in office, and that's when they'll tell you you have fibroids or not. So ultrasound is a good initial screening test, but it's not very accurate. So for all the patients that come to us, we do an MRI of the pelvis that gives us the whole picture of your pelvis. Because a lot of times other things may look like fibroid on ultrasound, but when we do the MRI, you'll be surprised. There's no fibroids or there's something else. Okay. So with MRI of the pelvis, we get all the information, and we could plan our treatment accordingly.
Okay. That's amazing as well. What does now I know you're probably not in this version of a person going through this treatment procedure, but do you know if insurance covers a uterine fibroid embolization, or is this something I have to kind of save up and pay for?
No, most of the insurance is covered. The majority of them cover, and we take all insurances, so it's typically covered by insurance.
Wow.
But my office will definitely check the benefits, and they'll let the patient know ahead of time how much it's going to cost them out of pocket or how much the insurance covers. So we'll give all the financial information to the patient ahead of time, because that is a very important factor in making diagnosis. Or in some patients, let's say the insurance doesn't cover at all, then we do have payment options. We have a payment plan, and we have a discounted cash pay price, and we give all this information ahead of time to the patients.
Okay, so I'm going to make a commitment, Dr. Uma, that after this is pre-recorded, but after this airs live, I am going to share. And I encourage all my followers or anybody who hears this, as my dad's a pastor, under the sound of my voice, I'm going to share. Reason why is because this is non-invasive. It's a quick recovery, 1 week, about a week. Insurance, most insurance, or it's covered by insurance. And then if not, there is a payment strategy in place, and you keep your body parts. I mean, and most women, I should say, who suffer from fibroids, this is an option for you, regardless of the location, the size, and the number of tumors that are non-cancerous that may reside in your system, in your body. There is a relief, that there's a way you can still have life beyond the detrimental, thought of having to have a hysterectomy. I was told by a certain medical facility for a different reason that I had to have, I'm gonna put it out there, VA, because it's my show. Doctor told me I had to have a hysterectomy, and I'm done having kids. When he told me this, it was about a little bit over a year or so ago. I panicked. Inside me, when I left and I'm driving in my car home and I'm having my conversation with God, and I'm thinking, God, I know I'm not having any more kids, but I do want to die with everything I got inside of me. So, now, of course, unless I did sign up to become a donor, but at any rate, beyond that, I don't want that portion of my body removed unless it's like an absolute must, life, death. You got to do this kind of thing, not just because it's what you think is best for me, because that's how it was presented. I think you should have, this doctor did, this hysterectomy, because I can't tell you if what's going on in your system is considered non-cancerous. And I'm thinking, okay, there's got to be another solution beyond you having to remove a body part, such as the uterine fibroid embolization. And I don't have fibroids, but what my situation it was or dealing with in that particular area of my body, he needed to do a biopsy. He couldn't biopsy well because I had an ablation done. I'm just thinking maybe the technique needs to change so that you can make an educated decision on what's going on with my body. But I digress. That's just my little stance on about having a hysterectomy versus getting a different.
That is a very, very valid concern. We do get women all the time like this. So that's one of the main reasons why they want to avoid a hysterectomy. They want to keep their body part, and that also they don't want to take the risks of surgery. Injury to bowel and the ureters, the bladder, and the infections, abscesses, and then the long recovery. They cannot afford to take months off from work. They don't have that much time off left. And also, there is long-term effects of hysterectomy. Like decades down the lane, women are at risk of getting heart disease, cancers, and diabetes. So there's long-term health effects of hysterectomy also. These are all the various reasons. Yes.
You said something that I've had 3 other women that don't know each other that have had hysterectomy have all told me, because I've had this conversation with them about what that doctor said about the hysterectomy. They said, don't do it because I am now a diabetic after having that hysterectomy.
Yes. Yeah,
I don't know if there's a direct linkage, but the fact that you just said that just validates my thoughts of, oh my God, my family I am one of those descendants that was blessed with being possible pre-diabetic or whatever, because that's in my lineage, right? Because of behaviors and patterns that were passed down to me. Nothing against my ancestors. They did the best they could with what they had. But it's just, I'm taking a stance, and part of why this podcast exists is so that I don't continue that. I'm trying to cut it off at its knees so that my children's children can live a healthy life with wealth and wisdom as long as they can, without having these gory things that we're having to deal with in our society simply because of our environment and our behaviors and our patterns that's been passed on from one generation to the next. I'm so glad that you, professionals such as yourself, that you do work with OBGYNs within the Dallas-Fort Worth area. And I do understand that gynecologists don't perform these things. So folks, don't go straight into doctor fill in the blank and you're going, hey, how come you didn't tell me about this UFE thing or this I don't understand. It's not something that they're checking for, okay? It's not something that they're looking at initially. You kind of gotta get to a specialist such as Dr. Uma Reddy for them to properly diagnose and give you a great treatment plan surrounding having fibroids. To the gynecologist's defense, unfortunately, their first reaction is, let's just have a hysterectomy and just get rid of it. I'm just being real. It's not on their radar. So you would definitely need to ask your OBGYN to be referred to the Fibroid Institute if you have fibroids, or just reach out and all the information will be down in the little section below, because this is going to be on YouTube. You just reach out to Dr. Uma Reddy and just reach out to the Fibroid Institution yourself so that you can get relief. This is serious, especially to my African American women. This is very serious. It's one of the things that we have to make sure we're following up on within ourselves and doing what it takes to make sure we can have prolonged health without continuing to suffer in silence, thinking our symptoms are related to something else, which actually could be related to this, that can be handled very simply with minimal evasion. No surgery. Nobody's cutting on you and taking stuff out. No, this is amazing. I love it. So, Doc, tell me about the Fibroid Institute.
Right. So the Fibroid Institute, excuse me. So it's an independent practice, office-based practice, and it offers only uterine fibroid embolization. And then
so you only focused on this?
Yes, this is the only procedure we do. Yes, there's only two of us, me and my senior founding partner, Dr. Suzanne Slonin. There's only two of us physicians performing it. And we both are interventional radiologists, obviously, and we used to do all the other different types of procedures. And together we have done more than 35,000 procedures. And with that experience, yes, we both are passionate about this procedure, and we think this will help women, and it's life-changing. And so we've stopped doing all the other procedures, and this is the only procedure we do now, day in, day out. This is the only diagnosis we treat, only procedure we perform.
Wow.
And so that's two of us. And then the rest of our staff, from front office to the nursing to the technologist, everybody is very compassionate. They'll make sure patients have excellent experience. All the patients' questions, concerns, they're all answered. And most of us are women staff, so we're all very compassionate. We understand. When a woman complains, has an issue, we know what we're talking about. So we all make sure women has excellent experience.
And that's important that you're laser focused on something that you're giving life back to an individual, to a woman who has been suffering, like you said. Sometimes, unfortunately, it just takes those years of being in pain, basically, and heavy bleeding and all of that other stuff before we get to a person like you. But because my hopes is, and that because I'm having this conversation with you, and I want to share, and I'm asking others to share, we can reduce the amount of women that are in pain, suffering from something that can be handled with little to no risk to that particular individual. I am so I'm so grateful and deeply grateful, and that you and your team are passionate about this, because this is why we're here, right? In this world, this feels like a purpose and a passion for you, and in terms of your expertise and what you bring to the table for the Fibroid Institute. Amazing. Oh my God, it's amazing. Now, a little birdie told me that you guys have a special way of how a woman is treated when they come to you the first time. What does that process look like?
Yes. So, actually, let me start with why a lot of physicians don't refer patients for this procedure. It's because they probably did in the past and they had bad experience. Because dying fibroids are very painful. So this procedure was typically done in hospitals. So when the woman goes to hospital and gets the procedure done, goes home, and then there's no contact between the performing physician and the patient afterwards. So any issues, patient will have to call their gynecologist. So they're very painful, the dying fibroids. So they used to call the gynecologist, and we all had a very, very hard time managing the pain in the past. So now, Dr. Slonim and I, we perform a nerve block right before we do the embolization. It's a small needle stick around the belly button, like a flu shot. It's a very small needle stick. Sometimes we can't even see where it was, so we may not even put a Band-Aid.
Okay.
Or if we see it, we'll just put a Band-Aid. So it's a nerve block, so it makes all the pelvic organs numb, so that takes care of the majority of the pain that you will have. So now the patients go home within an hour after the procedure. They go home with a pain of 2 out of 10 on a scale of 1 to 10. Their pain will be either 2 out of 10 or 3 out of 10. So they all go home with a smile on their face, and we do give them a lot of pain medications to take home and a clearly printed out schedule on how and when to take the medicines. So with our nerve block and the pain protocol that we have afterwards for 1 week, pain is well under control and pain is not an issue anymore.
Awesome.
Yes.
Awesome.
So when the patient first calls our office, obviously we get all the information, the insurance details, and then we do a consult. Initial consultation involves discussing the procedure and explaining to them and doing some physical exam. We don't do pelvic exams, that's done by gynecologists, so we don't do anything from down below. All we do is just like on top of your belly. And then we get an MRI of the pelvis to see how and where your fibroids are, so we can plan better. And then, like I said, majority of the women are candidates or eligible for this procedure. And then we'll check your insurance benefits and we'll tell you the cost of the procedure, and then we'll schedule the procedure. And then post-op, we are completely available for the patient. We give our cell phone numbers to patients, so patients call, text 24/7. They always reach out to us. So it is not a problem for the referring physicians like in the past. They don't have to worry about controlling the patient's constipation or pain or nothing like that. So we own the patient until they're completely recovered. We follow them up to 4 months after the procedure, and then they don't have to schedule any more appointments with us.
Wow.
We take complete responsibility.
So if I was going through this process post-op, I have direct access to my doctor. Hey doc, I'm texting, hey doc, I don't know if this hurts or I don't know about this, and I'm getting a response from you versus having to go through a receptionist, a nurse, and wait on a call back that could take 3 to 5 business days, and by that time I done took some Tylenol and went to bed.
Yes. yes. No, you bypass all those steps. You just can call me directly or text me directly. And same thing with Dr. Slonim. Yes.
Oh, I'm loving this. Oh my God, I'm loving this. This is giving me chills. Doc, you have no idea. I'm a person that it takes a lot for me to get excited about things. And this is one of these things I'm like, wow, this is a no-brainer. I mean, when I'm done with you today, my daughters, individually or together, don't know how I'm going to do this. Hey, we need to follow up with the gynecologist, or I'm going to ask these questions about the symptoms, and then say, you know what, let's just go on, bypass all of that and contact Dr. Uma Reddy, because you on my insurance, and my granddaddy would say insurance. Since you're on my insurance, we're going to make sure you're not experiencing more than what we thought was just a generational curse, in a sense, of us having these heavy bleeding and all of this stuff that goes on with our cycles. Yeah, we're going to make sure you're good to go, because I want their lives to be productive the older they get, and not them getting to my age trying to figure it out. How can I live a little bit longer than 50, whatever, Wow, that's amazing. So does UFE treat anything other than fibroids?
Yes. So there is another condition called adenomyosis. It's also a problem in the uterine wall. The inner lining grows into the wall of the uterus, and it's called adenomyosis. and that is, it causes the same symptoms like fibroids: heavy bleeding, cramping, pain, all of that. And that condition is hard to diagnose on ultrasound, or it may look like fibroid on ultrasound. So a
Okay.
lot of times patients are told they have fibroids, that they do all the treatment, medical treatment for the fibroids, and nothing helps. And then eventually they come to us, and then we do MRI. On the MRI, you can tell whether they have fibroids or adenomyosis. So
Wow.
this procedure, the embolization that we do, it works for adenomyosis as well. We just have to change our technique a little bit. So we use, to block the blood flow to the fibroids, we use tiny, tiny particles. They're made of acrylic, gelatin-coated acrylic, and those particles, they're FDA approved, and we've been using them for 30 years, no problems with particles. So if it's adenomyosis, we use the same particles, but just a little smaller size. So our technique will be slightly different if you have adenomyosis. So it's important for us to know whether you have adenomyosis so we can treat it accordingly. And also the difference between the fibroids and adenomyosis in terms of clinical results after embolization. The results are very good with fibroids, more than 90% clinical results with fibroids alone. And if somebody has fibroids and adenomyosis, it's about 80%. The clinical results are slightly lower with adenomyosis.
Okay. Wow.
But again, yes, we do treat patients with pure severe adenomyosis, and majority of them had excellent clinical results.
Wow. This is amazing.
Yes.
This is me wanting to go back and rewind time and say, can I just show up and check me out?
I know.
I'll be 50 this year, and my body's already knocking at the door of menopause, and I'm like, oh my God, I'm not looking forward to that.
Yes. So typically after menopause, if you have fibroids, they should shrink and die away and cause no problems to you, or your body cannot make new fibroids. But having said that, we do get some postmenopausal women with fibroids. They don't die right away, so they continue to be there and cause not bleeding, but they can cause pain. They can cause pain, They can cause bladder issues and constipation and the bowel issues. If those symptoms continue even after menopause, then fibroids could still be there and causing these problems. So we could do the UFE in those patients as well.
Oh wow. Oh wow. That's dope. I like that you can catch it before menopause, and I didn't realize that this could continue after menopause. I just thought maybe because menopause kind of wipes cycles, having cycle away.
Yeah, typically. Yeah.
That it kind of reduces a lot of different things. So, wow. So do you recommend, if a woman has no symptoms and maybe have a fibroid or whatever, do you recommend that they still have this procedure, or do you just do it only if you have the symptoms?
Only if you have the symptoms.
Okay.
So because fibroids are not cancerous, if they're not causing any problem, you don't need to do anything about it. Forget about a hysterectomy. You don't even need the embolization. But recognizing the symptoms of fibroid is important. Like I said, it's not only the bleeding and pain. It can cause blood clots in your legs. So you may have swelling in the legs, redness, and they do ultrasound, there's clots. Or you may be going into kidney failure because fibroids can push on your the ureters or the tubes that connect your kidneys to bladder. So they can cause kidney failure also. Or just anemia itself. Anemia from the bleeding, it's a silent killer. We've seen women that suffer from fibroids, heavy bleeding, and they don't want hysterectomy, so they just keep suffering to the point that where their anemia is so bad that they can't even walk a few steps. They get breathless. There were patients that we caught them in the office and we had to send them to emergency room and get blood transfusions right away. And we had patients with a severe kidney failure, and they were about to go into renal, like a complete end-stage renal disease. So identifying the symptoms. A lot of times you think it's normal, but it could be fibroids. So if you have any symptoms, just get the ultrasound done, bring it up with your gynecologist or primary care, get checked, and just know whether you have fibroids or not.
Wow. So I have two questions for you. Well, actually, the first question is not necessarily a question, but I just kind of want to confirm that this is not something, folks, that can be identified through a pap smear. You need, and the whole time we've been talking, we didn't say where you go to your annual exam and the doctor press on your stomach and do all those other things that they do to us, just to find out if we have an abnormal pap smear. So it's not detected that way. The doc
Right.
just said it's through the symptoms, and take it. And if you feel like,
Ultrasound.
you have a good number of these symptoms that's going on with you, I encourage you to take that next step and follow up and contact Dr. Uma Reddy. So, Doc, how can an
Yeah.
individual get in contact with you?
Yes, I'm going to give you all the information, but before we get there, I just want to add to that the size of the fibroids and the symptoms, they may not always match. You
Okay.
may just have a 2 centimeter fibroid that the doctor cannot feel by pressing on your belly. It may be very small, but it can cause terrible, terrible symptoms. Or on the other hand, you may have a big lump, a 10 centimeter fibroid, that doesn't cause any problems to you. So the size and the symptoms, they don't always match. Yes, fibroids are very unpredictable. You could have the same fibroid for years with no symptoms, and all of a sudden, it can cause problems.
It sounds like
Or
a terrorist. Look,
yes,
I'm retired military, and I've been on the battlefield, and you cannot detect the terrorist. So
yes, they're very
it does not matter
unpredictable.
what he got on, he or she got on.
Yeah,
No matter what they look like or what their background, nothing.
that is a perfect comparison.
So a fibroid is a terrorist for a woman in our bodies.
Yes, we kill the terrorists.
I know that's right,
We
Doc.
embolize them.
I know that's right.
Yes.
Take them out.
Yes, yes. So the
Awesome.
patients can find us, reach out to us directly. They can call our office at 214-838-6440, or they can go to our website, fibroidfree.com, and we have all the information for patients and symptoms. All that we talked about, it's all there on our website, so patients can read through it. And if there's any questions, we can also do a free screening. Our nurse practitioner talks to them briefly and just tells them whether it's a good procedure, a good solution for them or not. So
Correct.
they could do that. So yes, we are available for patients. We are on social
Awesome.
media. We're everywhere.
And you're also located in the Dallas-Fort Worth area and in Houston?
Yes. So our the procedures are done in our office in Dallas here in 635 Hillcrest location, and we also have a center in Houston.
Okay.
But we do have clinics all over Dallas, DFW Metroplex, and McKinney to Duncanville. We do have clinics there where we see patients, but the procedures we do in Dallas.
Wow. And folks, she just said they offer free screening. F-R-E-E. Ara, like my ancestors would say, F-R-E-E. Free 99 to get checked out to make sure or to ensure, if you are a candidate to have a procedure as this done, the uterine fibroid embolization, get that screening. And I'm sure you can go to the website. You said fibroidfree.com. Go to the website and get all the details to figure out how you can sign up for a free screening. I know my daughters, whether they want to or not, and if I got to drive them, I will. I have no problem. They're going to be in line because I want to make sure that they can continue life beyond, suffering and pain and have certainty. If nothing else, it doesn't hurt to be certain that you're okay. So, Doc, I want to thank you for your time on the Numbers Game with me. I am your host, Ms. Kim. And Stacy, thank you for participating in the chat session. I know some of awesome. So some people probably wondering, why is Kim typing or whatever? Because you can chat with me if you ever choose to be an audience member on the Numbers Game. So I'm not going to take up any more of your time, Doc. This has been powerful information. Once again, share. Once this is aired out, because we need to get the word out that you no longer have to suffer in silence if you are an individual that suffers from having fibroids. So, Doc, thank you. You've been great, a great guest. Thank you for having me be on a part of my show. And maybe one day, maybe I'll run into you. I don't know. I hope I know.
I'd like to meet you. No, it was great talking to you. Thank you for having me on your show. I do want to meet you, not as a patient, but outside.
Not as a patient. Yes, we go and sit up at Starbucks and chat it up. Yes.
Exactly. Yes, I'm in.
Awesome. Awesome. Well,
Alrighty.
Doc, you have a good day and thank you for being on the show. Hope you just enjoyed the last show. So be sure to hit that bell twice, 1, 2, so you can keep up with your girl. Oh, just look at me making a mess. And I got my fur buddy, King Solomon, with me. See you next time. Peace.